My name is Judy Dukeshire, and I am the Director of Nurse in the Future, and I'm joined here by Kate Corneau, who is the Program Coordinator. And we are very excited to offer you this session today on preparing for the NCLEX in Canada. And I have to tell you, I've been working with Shelley for a while now, and it's such a privilege to work with Shelley. She always offers herself up despite how busy she is. And she's always been so generous with Nursing the Future and offered this session to all of us gratis. So appreciate that, Shelley. So Shelley Looning is a certified nurse educator with over 18 years of experience in the continuing education industry. Shelley recognized the need for a structured, comprehensive study program to prepare RN graduates for the NCLEX, or the National Council Licensure Examination. As a result, Shelley and her team of highly experienced NCLEX faculty have developed a comprehensive program that promotes success and assists 100% of their students to successfully pass the NCLEX exam upon completion of the NCLEX education program. The team has already helped probably thousands of aspiring nurses just like you in their journey. So I just want to welcome Shelley and thank her again. And Shelley, the floor is yours.
Thank you so much. And thank you, Judy and Kate, for having me. I'm excited to be here. I love doing sessions and webinars for NTF and for future nurses and any kind of educators out there as well. I see a couple familiar faces actually on here, so it's nice to see. So thanks again for having me, and we're going to kind of get into it. But before we do, I'd love to know where everyone is tuning in from. And if you're comfortable, I would also love for you to put your camera on. It's really nice to see faces. I'm not picky if you're in your pajamas still. It's we don't care. We don't judge that. Just you put your camera on. We love to see faces. I love to teach to people instead of names on a black screen. So if you're comfortable, please turn that on. I also like to make this as informal as we can. I know I think there's quite a few on now, and hopefully more will join. But if you have questions along the way as I go, I'm more than happy to answer those questions. And you can stop me. You can put your hand up if I see it. I'll definitely answer. Or you can also put them in the chat box, and I think Kate's going to monitor that for us. So Judy, I can see that people are answering the poll, but I can't see the answers. Do you see the
So I
answers?
think I have to end the poll and then it
Okay.
displays all the answers. So I was just trying to give everybody an opportunity, but I think I'll end it now and then we can,
Sure.
yeah. So we've got Kamloops, obviously, Laflec, Saskatchewan, Burnaby, BC, Conception Bay in Newfoundland,
Wow.
Toronto, Vancouver, another from Newfoundland, London, Langley, BC. Yeah, another individual from Newfoundland, Labrador, Saskatoon, Edmonton, Grand Prairie, Maple Ridge. Wow, Fort St. John and PEI. That's super exciting.
Wow, one coast to the other. That's awesome.
Yes.
Oh, awesome. Okay. Well, welcome everyone. I know we're all probably in different time zones as well. So, good morning or good afternoon, depending on where you are. I've been working with lots of UK nurses, and so I'm often saying good day now because their time zone, and I never know what time it is, and they love to say good day, which I think is so nice. So, thanks again. And today, what we're going to do is we're going to talk about the NCLEX. And this is for you. So I want you to get what you need out of this session. Some of you maybe have taken the NCLEX already. Some of you might just be getting started with your preparation and journey. Many of you will be at different levels on what you know, what you want to know. And so we're going to kind of go back to some basics a little bit. I'll go through that quickly and then really get into the NCLEX itself. So before I do that, I think Judy kind of explained a little bit about my background. I'm really passionate about helping people pass the NCLEX. I have been teaching nursing for a very long time, and this is by far the most rewarding teaching I've ever done. I work with students from all over the world. some who have never taken the NCLEX and use our program to start with, and others that have struggled to pass the NCLEX and have found us. And there is nothing more rewarding than helping someone who wants to be a registered nurse become one. So I love what I do. I love our team. I'm very lucky being the owner. I get to pick the very, very best faculty that I've worked with over the last 18 years. So feel very fortunate for what I do. So I hope everybody finds what they're looking for in nursing, but I've certainly love what I do, that's for sure. Okay, so what we want to do today, and again, if there's things that come up that we don't address and you want to know, please put them in the chat box. I'm really happy to answer any questions, anything and everything NCLEX. So what we want to do though today first is I want to review the NCLEX exam process itself. There's lots of myths and misconceptions out there about the NCLEX. I want to talk to you about how it works and how you're going to pass it. It's really important that I feel that if you don't understand the NCLEX itself, how do you pass it? And it is a complicated exam. It is also changed recently, so there is some big changes that brought in last April. And so, it's important to really understand how it works in order to be successful. I want to look at the different types of questions. So I'm going to show you all the 14 types of questions that possibly could be on the NCLEX, which I think it's important to see and understand them as well as practice those questions. We're going to look at some tips and tricks for taking the exam, and I'm going to share some NCLEX-RN study strategies along the way as well. So a few tips and tricks and all sorts of information that hopefully will help you in your preparation. So as I've started this business in NCLEX, so I'm not sure if people are familiar with how NCLEX came to Canada, but it came to Canada in 2015. Prior to that, we had what was called a CNRE exam, which was an exam just for Canadian RNs, and we had a really high pass rate in Canada. And when the NCLEX came, our pass rate absolutely tanked. And it went actually as low, in the 40% in some provinces, in the, 46%. It really, really dropped significantly as compared to, for example, in Saskatchewan, I think we had about a 97 or 98 percentage pass rate. So it really, really dropped, and that was really concerning. And of course, the students taking it were devastated. And there was a lot of work around what are we going to do? How are we going to manage this? What are we going to do with the students? What kind of preparation should people be doing? All of that kind of started. And that started to lead me to tutoring students and then developing an entire program. And what I found with lots of the resources that were on the market is that they weren't comprehensive enough. So most students don't really know where they go wrong when they start NCLEX or where to start. And so I felt like, how do you choose a resource if you don't even know where you're going wrong? Because the resources are so unique and really focus on one area. So that led me to develop a program, which we have been running since 2015. So the components, whether you choose to use a program like mine or you're studying on your own, the components to success, what we've really found working for years with students in this space, is that there's really 5 things that help students become successful. And I find that sometimes these things get missed. And that could be a reason, why students are unsuccessful. So the first thing is really making a study plan. So making sure you have a way that you are going to address NCLEX. There's so much. If you think about all the learning you've had in your degree program, all the different courses, how do you even begin to study that information? And, you want to get through it concisely because you want to be ready to write this exam. And so coming up with some kind of way to tackle that, you do need some kind of outline plan, whether you purchase something or whether you do it yourself, you need a strategic way to do that. You really also need to understand the NCLEX exam itself. and the test plan. And we are going to cover lots of that today. So you really understand, how does it work? How do I pass? How do I fail? What is an integrated process? What kinds of topics am I going to have? How does the exam itself work? Why does it shut off at certain questions? So really important to understand all that. It'll help with your anxiety, as well as really understand kind of what goes on and what goes into that exam. Learning how to read the questions, really, really important. So I find that, as people take the NCLEX, they often will read a question and they think, I don't really understand what they're asking. Or they think, many questions can be really confusing. And, they're not entirely sure. And so it is really important to read that question and understand it so that you get the answer correct. If you're reading it incorrectly and not picking out the important strategic words and understanding what they're looking for, it's going to be really difficult to get the correct answer. So we actually built an algorithm on how to approach questions, do this, 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 and this, because we find that students kind of get off track, they second guess, they read into the question, those things that can happen when you're reading a question. Understanding content. This is huge. So I find, in most nursing programs, and I've taught in a couple, their classes, your classes that you're probably maybe taking right now are really like fast and furious, right? And you are buzzing through this course and you're trying to learn the content, but you end up memorizing for an exam and sort of spitting it out and then kind of forgetting about it. And unfortunately, in nursing, we can't do that. You really need to understand concepts and content for NCLEX. And I'm going to show you why today. I'm going to show you kind of a reason why it's so important to understand content. They really want you to put lots of things together in NCLEX. And if you're memorizing, that doesn't work. So I'm going to show you how that works today. And then really getting yourself mentally and physically prepared. So I always encourage students to use a resource that has the questions that are exactly like the NCLEX, that gives you an opportunity to do exams, so you can practice exams prior to the actual exam, doing a short exam, a long exam, an in-between exam, really getting yourself mentally and physically prepared, dealing with test anxiety, getting ready to know what that test environment is like. All those things are really, really important in your success. All right. Let's just talk quickly a little bit about what an NCLEX actually is. So what is it and why did it start? Basically, what it is this analysis of practice of new grads. So as you come out of school, or maybe you're practicing for the first time in a new country, this is a exam of your knowledge, skills, and abilities. And what they did is they did this analysis to see, as a new grad, what would you do in the environment? And the most common environment most of you are going to get a job in, about 96% of you, is acute care. So they did a focus mostly on acute care because that is mostly likely where you're going to work as a new graduate. And what they did was, it wasn't it wasn't a grad nursing position, which sometimes people think when they hear a new graduate. It was within that first year of work, which is entirely Judy's space, which is awesome. Looking at that transition to practice in that first year and how important it is. And so they looked at, what do you need to know to keep yourself safe and to keep your patients safe? And so nursing specialties are not tested. And I often hear this from students. They say, yes, except there's obstetrics on it. There's critical care on it. There's all these things that are on the exam. And the way I explain that is, if you were working as a brand new nurse in Northern Canada somewhere, let's say, and you might be the only nurse there, and you have a laboring mom come in and she is going to have that baby. You need to know how to keep her safe and to keep the baby safe. Are you an expert in obstetrics or neonatal? No. But you do need to know the basics in order to keep this person safe and this baby safe. Okay. And so that's kind of, what they look at is, can we keep our patients safe if we were practicing somewhere? So you do have to know a few little things, but you aren't expected to know it at a specialty level. Now, the exam itself is computer adaptive testing. Does anybody here know, and you can put in the chat box, what computer adaptive testing is, or CAT testing? Anybody know? You can throw it in the chat box if you know. While I'm waiting for your responses, I'll also talk about that this test plan is reviewed and approved every 3 years. And so every 3 years, they look at that test plan and they revise it and they look at the stats. And sometimes we'll say what they do is they make it more difficult. And what they are really doing is just revising it, updating with new content, new information that's come out, and looking at those statistics on questions that might be a little bit easier or questions that are too difficult. Okay, so someone said testing that is adapted to your specific level of knowledge. Yes, in a way, absolutely. So what it actually is that it is actually creating the exam as you take it. So depending on how you answer the question will depend on the question you get next. So it's absolutely, amazing how that software works, that every time you answer, it becomes more and more specific and precise. So no two of you on here today will get the same exam. So it's kind of crazy. And so, it's really estimating how you're going to answer, then, however you answer, and then creating that next question. And the way it does this is 3 criteria. So people, often ask, how do they pick these questions? And they use 3 criteria. So they have a large pool of questions. And what they do is the first thing they do is they figure out if you are going to get a question about 50% chance of getting it correct. Okay. So I always think, think of it as a yardstick. So if you think about it, you have a yardstick. And 1 is a very, very easy question. And 8 is the hardest question. Let's think of it as a 1 to 8. Okay. And so if you think about it like that, you have, easy questions and really hard questions, level 1 to 8. And so what it's going to do is it's going to ask you a question, and depending on how you answer that, so let's say it's a level 2 question and you get it correct, it's going to give you the next question that you have a 50% chance of getting that correct. Okay, so it's not going to jump from a level 2 question all the way up to a level 8 question. It's not going to do that. It's going to probably give you a level 3 question, and you're going to sort of climb a ladder up and down. Okay, so it's not going to be too easy and not too hard. Just kind of right in there so that you're able to have 50% chance of getting that correct. It also needs to take enough questions from what's called the test plan, and I'm going to talk about the test plan briefly today. So the test plan has different categories and subcategories, and it needs to stay within those percentages. So sometimes we hear, students say, my exam was all pharmacology. Well, it can't be. Okay, so there's only a minimum to a maximum criteria of questions it can pull from each of those sections. And so it needs to stay within those when it's asking you questions. And the new and next generation NCLEX or NGN that you might have heard about, it also includes case studies. And so those case studies are not computer adaptive. They're standalone. They don't change depending on how you answer them. You'll get the same questions for that case. Okay. And the other way it pulls is it makes sure if you're a repeat test taker that you're not getting the same questions that you might have got on your last exam. So it takes a long, long time, lots of repeat testing before you're ever going to see other questions or, the same questions. You're always going to see different questions. And so sometimes for repeat test takers, that's where they get into trouble. They think, what, if I just study a little bit more and then I take it again, I'll do better. But in fact, they often don't, and they maybe, are weaker in other areas that they weren't before. Okay, because you're not going to see those same questions. So you don't need any experience to take this. There's a little tutorial on the NCSBN site. And I'm going to give you a link to a site later so that you can go and look at some of this information up if you like. And there's sort of this general guideline of how to take the exam, all of those tutorials that you can take before you go, which is really nice so that it kind of eases some of your anxiety and you can kind of know what to expect. So that's all on the site for you. There's also a proctor there that will be able to answer any questions that you have while you're taking the exam. So the exam itself is now a minimum of 85 questions and a maximum of 150 questions. So it has gotten shorter, significantly shorter, because at one time it was actually 265 questions. So they have dropped it by quite a bit. You have a maximum of 5 hours to take the exam. That's not including any that's not including any accommodations that you might require. So if you have accommodations in school and you would like accommodations, you have to go through your board of nursing or your registrar to get those accommodations, but you definitely can apply for those, and they can extend maybe your time if that's what you're needing. Now, 52 of the questions will come from the different client needs categories and subcategories, and 18 questions are always from 3 cases. So everyone will have 3 case studies on their exam, and each of those cases will have 6 questions. And I'm going to show you what a case looks like today and show you kind of what to expect on each question of the case study. There's also 15 questions on this exam, which are called pre-test questions. And this confuses people. You won't know when they pop up. You won't know, which question it is, but everyone will have 15 questions, whether you write 85 questions or 150 questions that don't count. Okay. And students are like, what? Why do I have 15 questions that don't count? But the reason you do is because they're actually looking at kind of your ability. So let's say that you are an absolute rock star and you take 85 questions, the exam shuts off and you pass. Let's hope that that happens to everyone. And so with that, they're going to look at those 15 questions and see, okay, how did you do on those questions? And they're going to use those statistics to guide them to rank those questions on level of difficulty. So remember, we talked about an easy question at level 1 or really difficult question at level 8. They're going to rank those questions, and they're going to also look at, kind of all those statistics with any kind of questions and test questions out on you. Okay. So like I said, there's always a proctor there. It is videotaped and audio taped. So it makes people nervous because it's, you're being videotaped and audio taped. And that can definitely, spark some anxiety in people during that exam. So knowing that in advance sometimes helps people. There's no food or drink, no electronic devices, your watch, anything like that, none of that in the exam room itself. No scrap paper. You will be given a locker. And in this locker, you can put your food and drink, and your devices and your phone will go in a separate sealed envelope. And during your breaks, you can access your food and drink. So at 2 hours and at 4 hours, they will give you a break that you can go to your locker and you can have a drink or some food. Of course, you can't access any of your electronic devices. They'll be in a separate compartment. So no scrap paper, but they will give you an erasable board and marker. And you can write whatever you like on this board and marker, but you cannot, or board with marker, but you cannot erase it. Okay, so they call it an erasable board, but you're not allowed to erase it. They will take it if you fill it up. So if you do fill up the board, you can put up your hand and you can have someone come and get that board, and they will take a picture for your file and they'll bring you a new board. Okay. So important to know that. And the other thing that's really important is that you cannot do what we call a data dump. Okay. So some of you might have done this in school where, let's say you're writing an exam and there's blood gases on that exam. And so what you do is you go into the exam and you write down all your blood gas values to remember. And you just have it there on your piece of paper for when that question comes up because you don't want to forget. You can't do that on NCLEX. Okay, so you have to, you can't walk in and write anything on that board. Once you get going and you're into questions, you can use the board as you see fit, but you cannot sort of do that data dump where you're going to write a bunch of things down ahead of time before you get into those questions. So just remember that, or they would consider that cheating. Okay, any questions so far?
Shelley,
Yes.
Judy, I just wanted to ask a couple things.
Yeah.
I understand because people can't take their watch and they can't look at the time on their phone, but I understand that there's a big clock right in front of them at all
Yeah.
times. correct?
There's a clock. It's actually right on the computer. There's a clock on the computer that tells you what time. It also tells you what question you're on. So you're able to see. You can change that as well. So some students don't want to see what question number they're on, and you can actually turn that option off if you don't want to see, because sometimes it makes people nervous if they go past the 85 questions. They don't want to know. So you can actually turn that option off as well. So you can do it off or on. Yeah.
Wonderful.
And there's
And
also an online calculator as well. For any questions that you might need a calculator, it's online.
cool. Okay, thanks, Shelley, for that. And I just wanted to ask a question about that data dumping because that's really fascinating.
Yeah,
So you can't just write anything on that board unless you've had a question about it. Is
that's
that
right. Yeah,
and
that's
so
right.
when they take that erasable board that you're not allowed to erase and give you another board, they
Yeah.
take a snapshot of the board to um to have evidence that you did not breach anything, or if you did.
That's right. Yeah, exactly. Yeah. There's really high stakes security on this exam. It really makes people nervous. So when you are, going in to write this exam, they're going to scan your palm. They're going to take your picture, look at your ID. And so just be prepared for that. It's always that feeling, you're at border control, maybe in the airport, and you're like, and you haven't done anything wrong, but they have a way of making you feel very, very nervous. And that same feeling is going to definitely happen. So really high stakes security. They can't have any breaches in this exam. And that's why they do that. So you're not doing anything wrong. Just, make sure you're following these things and you'll be good.
Thanks, Shelley. There's just one question here about accommodations, and it
Yeah.
says, can you give a bit more detail about how you go about getting accommodations and how long it takes and what's the
Yeah.
process?
So accommodations would be similar. So if you have accommodations in school already, so accommodations could be a private room, it could be extended time, the same types of accommodations that you might have had in school. So of course, they all have to have a doctor's note when you are looking at accommodations. You do need your doctor's note, and they do have to be applied for through the Board of Nursing that you're registering through. So whether that's the CNO, like wherever you are, whatever province, that's where you need to apply for those accommodations. And the exams are booked through them instead of online. So they just have to make that accommodation of getting a different room or getting extra time and making sure that's all available. So you do need to just go through that Board of Nursing. Now, one caution that I always tell people, and I don't tell people to scare them, really look into the bylaws of your board of nursing or your registrar of nursing where you are applying for your license. Many of them have a small clause that says if you require accommodations during the NCLEX, they have the right to look at restrictions for your license. So I have not, and all my years of doing this, working with many boards of nursing across Canada and the US, I have never had that happen. But they do have the option. Many of the provinces and states have put a little clause in there that basically saying, let's say it took you 10 hours to take your NCLEX, they have the right to look at that and to restrict your license to make sure you're safe. If you do pass. So that sometimes makes people nervous, and I don't say it to make you nervous, just as to be cautious and to look at that if that's something that could impact you.
Thanks, Shelley. Judy again. When it comes to that note that you need to provide from your doctor, can that be the same note you already provided your school, or do you require a new note?
No, it could be the same one from school. Yeah. Yeah. If you've had accommodations in school, most provincial bodies will accept that. So it's whatever your provincial body will accept, but that's typically they will accept that if you've already had one. Yeah.
Thanks, Shelley. Those are all the questions
Welcome.
currently.
For now? Okay, excellent. So as you answer questions, it's pretty typical of maybe of some of the exams you've done so far, but you do need to hit next in order to go to the next question. So you can't go back and check your answer or look at it again, because remember, this exam is created as you take it. So you definitely need to keep moving forward and hit next. And so sometimes this is difficult because there are going to be questions that you maybe don't know. And especially with those 15 pre-test questions that could be anything. So you really need to have some strategies in your back pocket about how to make that best guess. So, what are you going to do if you have no idea? How are you going to approach this question? How is it going to affect your anxiety when you don't know a question? So sometimes, when people do an exam and they come across something they don't know, they panic. And so how are you going to work through that? So it's just something to think about, because you do have to hit next. So you can spend as much time on one question as you like. The exam itself is 5 hours. If you wanted to spend 1 hour on one question, you certainly could. I don't recommend that, but you could, the way the exam works. You hit next, and then that next question is created. So now I want to talk briefly about how you pass or fail this exam. You could just give me a thumbs up or a hands up if you've heard, all these different crazy things about, if it shuts off at 86, you failed. If this happens, you've passed. If this happens, I think all those rumors float around a lot. About, how you're going to pass or fail this exam. Yeah, I see some thumbs up and yes. So I want to explain how the 3 ways to pass or fail this exam. And there's only 3 ways, okay? And hopefully it'll become a lot clearer. So the first one is called the 95% confidence interval rule. And this is the most common thing that happens on NCLEX, okay? So what happens is when it is 95% certain that you're either clearly above the passing standard or below the passing standard, it will shut off. So let's go back to our yardstick that I explained. So we have the very easy questions down here, level 1, the very difficult questions at level 8. Let's say the passing standard is 6. Okay, so our passing standard is sitting here. And so what the computer is estimating is when it gives you a question, remember you're gonna climb that ladder with the level of difficulty. What it's looking at is that in order to be 95% confident that you've passed, you have to be above that passing standard in all of the categories. Okay. And that's where sometimes students think, oh, okay, well, I'm really good at these things, but this I'm not. You have to be above that passing standard. So you would have to be above that level 6 in all the things. And it has to be 95% confident that if they continue to ask you all the questions, you would still not be able to drop down below that level. Okay, so here's an example of, let's say that you're writing the exam in all the client needs categories. We're going to go through those in a minute. You are way up in the 8s. And so it knows, even if it keeps asking you, so it's maybe at 85 questions, and it knows even if it keeps asking you questions, you're not going to get back down below that passing standard because you're already way up here. Okay, it would shut off and you would pass the exam. Now the opposite can happen. Let's say you're way up in level 8 in, all of the client needs categories, maybe except for farm. And farm, you're kind of down here. Okay, maybe you're sitting below the passing standard, maybe you add a 4. And you get one right, and then you get one wrong. And remember, they're not all one after the other. They're all mixed up in the exam. It actually knows, even if it gave you the rest of the percentage of questions that you're allowed in pharmacology, you can't come back up that passing standard. There's not enough questions left that it could ask you. And so then the exam would shut off and you would fail the exam. Okay, so does that make sense to everybody? So it's either 95% confident you're way above in all the categories and it's going to shut off, or it's 95% confident that you are below in one or more of the categories and you don't have enough questions left to be able to come back up above to be able to pass. So it would also shut off and you would fail. Okay, so that happens most of the time. Not, it is the most common, but there are 2 other kinds. Okay. So the second other way that you can pass or fail is maximum length exam. And so what happens in this case is you have taken all 150 questions. Okay. And basically it wasn't certain that you were way above the passing standard or you weren't way below in any of the categories either. You're sort of probably just hovering that line. And you could even be hovering that line just in one category. You could be doing really well in all the others, but maybe you're hovering in one area. And so it can't shut off because it can't determine until it asks you all of the questions. And so what happens is you will get all 150 questions, and then they'll look and say, are you above the passing standard in all of the client need categories or not? If you are, you would pass. If you're below in one or more, you would fail. Okay. And then the third way is the run out of time. So here's where you have used all 5 hours of your time. Or if you had accommodations, you've used however many hours that you've got for the exam. You would fail automatically if you didn't do a minimum of 85 questions. So hopefully you would do at least 85 questions in 5 hours. But what they're going to look at after is however many questions you've done in that time, as long as it's over 85, they're going to again look, are you above the passing standard or below the passing standard? If you're below the passing standard in one or more, you would fail. If you're above in all of them, you would pass. Okay? Does that make a little bit more sense for everyone of how you pass or fail that exam? Any questions? There's a question in here. Yeah, so someone asked about an insulin pump during the exam. Yeah, you would just want to talk to the Board of Nursing about that prior to your exam, making sure that Pearson View that's where you write your exam is aware of that, but they would definitely probably just make sure, they'll look at it and let you keep that on during your exam. You just need to talk to your Board of Nursing.
Shelley,
Yeah.
if a grad is from Nova Scotia, for instance, do they have to write their NCLEX in Nova Scotia, or can they write it anywhere?
You can write it anywhere. So you can register in whatever province you want to work in, and then you can take the exam anywhere in the world. So I've even had students, I had a student that was going over to Germany for vacation. She wanted to register in Saskatchewan, but she was going on a vacation with her husband and decided to write it in Frankfurt. So you can absolutely sit for the exam and write anywhere you want. So you register in the province you want that license from and that you want to work in, and then you can take the exam wherever you like. So it doesn't have to be the same place. And sometimes I've had students that, come to me and they have failed the exam and they don't want to go back to that same place to write the exam a second or third time. So you could definitely, pick a new location. So if you're in, BC and you want to write in Kamloops and then you want to go somewhere else in BC, you definitely can do that. You just pick your location.
So you pick your location, Shelley, and all you have to show is permission from your registering body to write the exam, and you can write it anywhere. Is that
Yeah, so the way the NCLEX works, and I didn't really go into licensing as much, but the way the NCLEX works is you're going to apply to take the NCLEX, and the way you apply for that is through your Board of Nursing or your nursing registrar. So, for example, in Saskatchewan, the CNRS, right, or Alberta, the CNRA. So wherever you are, the BC nursing board. So wherever you're going to want to practice as a nurse, you first need to do all of their requirements. And so their requirements are, transcripts. So the school usually will send, or you'll have ask for your transcripts to be sent. So they need to make sure that you have the proper education. They'll have different requirements, criminal record checks, all those things. So the board is the people that make you eligible to take the NCLEX. And the reason they do that is so that we don't want Joe Blow the plumber to try to write the NCLEX exam. So they make you eligible to write the NCLEX, making sure that you have had the proper education, you're not a criminal, things like that. So they make you eligible to take the NCLEX, and they let Pearson View know that you are eligible. So Pearson View is just basically the place where you take the exam. And there's Pearson View testing centers all over the world. And that's why you can choose whatever location you like. And so those two talk in the background. So you make an application with Pearson, you make an application with your Board of Nursing, and those two talk about, is this person eligible? Once they say yes, they're eligible, then your account on Pearson will let you book that exam wherever you like. Okay. And when you book the exam, you get what's called an ATT, or an authorization to test, and that is for that particular exam. So once they authorize and you get that ATT, that is good for 90 days, and you will have 90 days to write the exam within that time frame. Okay. And so if for some reason you choose not to write, you don't get your money back for that particular ATT. You don't have to take the exam, but you wouldn't get your money back. You can change the exam within those 90 days up to 24 hours before the exam. So let's say you book it and you're like, oh, I just want another, 2 weeks to study. You can change that exam and book it and move it. You can move locations, all within that 90 days. If it falls outside of that 90 days, or you fail the exam and you have to take it again, then you would have to wait 45 days and then apply for a new ATT, which is a cost. Okay? Does that help people that?
Super helpful, Shelley. Thank you.
Yes, you're welcome. The registration piece can get a little bit, a little bit confusing at times. So if anybody has specific questions, you can always email as well. I think someone asked, can you write your exam in the States and then get your license in the States? So NCLEX is good for the States. So once you pass the NCLEX in Canada, you can apply to any board of nursing in the US. So you still, just like any province in Canada, you need a nursing license for each province that you work in. The same goes in the US. You need a nursing license in every state that you work in. But once you've passed the NCLEX, it's pretty simple to get that nursing license as long as you meet the state or the province's guidelines. Okay. Awesome. Okay, before we get into some of the other stuff, I want to just talk about the scoring on the exam. And so the scoring in the exam has changed, and there's different ways, and you might have heard this, there's partial marks on the NCLEX. And there is partial marks now, but not for every question. And so I just want to show you the scoring, and then as I go through the question types, I'll be able to tell you what's partial marks and what's not. So the first scoring rule that we are very familiar with is called the 0-1. And this is our classic approach to questions. Either you get, it correct or incorrect. And if you get it correct, you get 1 mark, or a mark of some sort. And if you don't, you get none. Okay. And that's very simple. That's multiple choice have been like that for many people. Most of your exams, a lot of the scoring is like that. And the old NCLEX prior to April of 2024 was also like that. So either right or wrong. Okay. Now they added what was called plus minus scoring. And what this is, generally where we're seeing this in NCLEX is in the select all that apply. So prior to the next generation NCLEX, if you got a select all that apply question, and let's say it had 4 correct responses, but you chose 5 instead of 4, you had all the 4 correct, but then you chose 1 incorrect, you wouldn't get any marks for that. You get 0 marks. And now what they're saying is they are allowing you to over or under respond. So for every one you would get correct, you would get a point. So let's say, you had chose all the 4 correct, so you get 4 points. But then you chose 1 incorrect, you would lose 1 mark. So you would end up with 3 marks out of that. Okay. So you can't go in the negative, but it does allow you a little bit of leeway. And so sometimes students think, oh, I can just select everything or not select anything, and that would work. But because you are, losing points for incorrect guesses or for missing, so you're over and under responding. And so you can't, the minimum points is 0. Okay. So you can't go negative on that question. Do you have a question, Judy?
No, that was my question.
Yeah. So and it doesn't carry on to the next question or anything. Like let's say we're -3 because you got them all wrong. It would just be a 0 for that question, and then you'd move on to the new question. Yeah.
But there's
And
no,
so sometimes, sorry?
no, I'm just thinking to myself, well, what if you just said, you know what, I'm just going to answer all of them
Yeah.
for anyone that says choose, the best response, and you choose all of them, there's not an advantage, and there's in fact a disadvantage to doing that.
That's right. Yeah. So it will allow you, it's still really tailored to allow students to over or under respond a bit, but not in the fact that you're just gonna, like Judy said, pick them all. That will actually, you'll probably end up with 0. So you still need to be strategic, but if you're just one off, you're still able to get some kind of marks out of that question. Yeah. And then the last type of scoring that they put, and we often see this in the case studies, is called the rationale scoring rule. And what this one is that it's a cause and effect question. So basically, both X and Y have to be correct. So a nurse must do X because of Y. And you would need to get both of those correct in order to get that 1 mark. And that's called a dyad. And we also see what's called triads where, a nurse must do X because of Y and Z. And in that case, you could get 2 marks because if you get, X and Y correct, there's 1 mark. But if you get X and Z and Y correct, then you would get those 2 marks. So it's a rationale and just putting things together and using that kind of paired information knowledge on a question. So we see that in the case studies as well. Okay, so I talked a little bit about why NCLEX is difficult and why you can't memorize. And I want to just show you a quick example on why this is the case. So Bloom's taxonomy, for those of you who don't know, is something that we use as educators to create questions and level of difficulty. And, most people are familiar with knowledge and comprehension questions. Those will not be on the NCLEX. They test at a much higher taxonomy. They test at an application, analysis, synthesis, and evaluation level. So basically, they're making it harder, those questions, same kind of material. And so I want to show you an example of this so you have an understanding. And this is a very basic example. And I use it just to sort of show how the same bit of knowledge can be transitioned into a much more difficult question. So here is the first kind of question. Which would be considered a knowledge or comprehension question. So which of the following is a side effect of digoxin? And if you guys know the answer, you feel free to put it in the chat box if you want. So for this question, we basically just need to know the side effect of digoxin. It's very much a memorization question. Either you have that knowledge or you don't. You don't really have to understand much. You might have memorized it. And if you did and you got the answer, you would know the answer is number 2, bradycardia. So very, very simple question. This would not be on NCLEX. Okay. Now, if we took that same bit of data about knowing about digoxin and we applied it a little bit more. So before taking a client's vital signs, the nurse asks him if he is taking any medications. He answers digoxin every morning and acetaminophen in the evening. Which of the following vital sign changes might the nurse anticipate? So in this case, we actually need to know a little bit more. We need to know what digoxin does, that it causes bradycardia, but we also need to know what bradycardia is. So now we need to know 2 things, and we're sort of applying it to this patient's kind of little, what's happening with him and what we might anticipate. So it's a little bit more difficult because we're needing to know a little bit more, but it's still nothing you would see on NCLEX. Okay, so the answer is 2, decreased pulse of 53 beats per minute. Now, this would be more likely on NCLEX, but again, still quite a simple question, but I do it to show you the level of difficulty that we can kind of get to. And so in this question, it says, the nurse is about to give the client his morning digoxin. His radial pulse is 45 beats per minute. What is the nurse's first action? So in this case, we need to know what digoxin does that causes bradycardia. We need to know that his radial pulse of 45 beats per minute is bradycardia. Okay. So we also need to know what we need to do for a client like this. But we not only need to know what we need to do, we need to know what we need to do first. Okay. So some of you might have read the question and said, okay, wow, I want to do all those things. But NCLEX wants to know what you're going to do first. So you see how we take that same bit of information about digoxin and made this a very, very different question. Okay, because now you're needing to know, okay, what do I do with someone if they have a heart rate of 45? I'm about to give them their digoxin. What am I going to need to do first? So again, this is pretty easy, and many of you, might have got the answer already. But you can just see how you're putting together all of these things versus just memorizing what digoxin does. Okay? Anybody know the answer? You can put it in the chat box. Yes, number one. Excellent. Check his apical rate. Good job. Fairly easy question, but hopefully that demonstrated, how we have to put all this information together and not memorize. Okay? So I've talked about the client needs structure, and I want to just show you a little bit of the categories. So the categories here are up here. And remember, I talked about you need to pass every single category. So that means, safe and effective care is a category, and the subcategories are management of care and safety and infection control. You have to pass both, be above that passing standard in both of those in order to pass the NCLEX. So not only in the categories you see in bold, but also the subcategories. You got to be above that passing standard in all of them in order to be successful with the NCLEX. So that's, it's a lot. And sometimes, people don't understand that and they think, oh, I'm not going to worry about this section as much. But you do need to be above that passing standard. Now, another key thing that's really important that I stress to students is there's what we call integrated processes on NCLEX. And so what that is these are things that are threaded into each and every question on NCLEX. So these things are fundamental to nursing, and they are things that you should know like the back of your hand. Okay. And these things are caring, clinical judgment, communication and documentation, culture and spirituality, and the nursing process, and teaching and learning. So all of these things, one of these things you see on the screen will be in each and every question on NCLEX. So it'll follow that client need category that I just showed you, but it'll also have all of this, okay? Or one of these things integrated within it. And so it's really important to know these things. And we think, oh, you know what? I know teaching and learning. But really make sure when you're studying, you're looking at these things, because sometimes that's a common thread that maybe gets missed. So for example, culture and spirituality, we do a pretty good job in Canada, I think, with Indigenous culture and, learning some of their practices, because there are many provinces, those are our clients, lots of our clients. We need to learn and understand that. But maybe other cultures you haven't dug into as much. And so really looking at understanding some of those things and being able to integrate them into questions. Okay. Here is the distribution of content. So remember I talked about the percentages. So they will fluctuate depending on how many questions. So this is why if, I shared the example where you're, just about to your exam and you're not passing the farm and it can't ask you any more questions because you have taken already 19% of that exam. So it has to stay within those percentages of the exam, and that's how it chooses the questions. So sometimes, like I said, students will say, oh, I feel like my entire exam was pharmacology. Well, if you had an exam of 85 questions and you had only 13% pharm, because you did really good and it didn't need to ask you anymore, versus you had an exam with 150 questions and you had closer to 19%. That is a lot of different questions, right? I can't do the math in my head, but it is a lot more pharm questions if you were closer to the 19% and writing the full exam. So it will fluctuate with that percentage, but it has to stay within that percentage. Okay. Here is a really good site, just nclex.com. Though that tutorial's on there, the test plan's on there for you to look at, and I encourage you to take a look at this before you take your exam. Okay. All right, I want to talk a little bit about clinical judgment. I think I have about 15 minutes left, 10, 15 minutes left. I want to talk quickly about clinical judgment, and then I also want to go and show you the questions, okay? The question types. So clinical judgment was added in the next generation NCLEX exam. And basically what clinical judgment does is it's looking at, can you critically think? Can you put those pieces together? It's so essential for our nursing practice that we do that. And they didn't really, up until this next generation exam, have a way to measure that. And so they did a lot of research. They came up with a whole clinical judgment model to measure that clinical judgment. And part of that was adding 18 case study questions to everyone's exam. So 3 cases with 6 questions per case. And then 10% they what they call standalone items. So 10% of the exam will also have that clinical judgment piece. And remember, it's one of those integrated processes too. So it could just be integrated, within a question of that 10%. And so the steps to the clinical judgment model are here. And I'll go through them in a little bit more detail. And basically, what this is, these 6 steps are your 6 questions. Okay. And so I'll just show it again here. So these 6 steps are your 6 questions of each case that you're going to do on NCLEX. So the first one is recognizing cues. What they want in this first step, they're going to give you a case study with some information. This case event of what has happened, the relevant information that you need to answer the case. The first question of every case wants you to pick out what is relevant, what's irrelevant, what's most important, what's of immediate concern. Can you pick out those things from the information that you're given? So you're going to often be given what looks like a chart. So you may have something like this, a history tab, and it's going to want you to pick out important information. So in a history tab, it's sort of looking for that health history that you think is significant. And you may have a type of question that looks like this. So you're dragging, things that you think might require immediate follow-up right from the beginning. Picking out that important information after you've been given some kind of a case. On a nurse's notes tab, it may be things like this. And so it's looking at like time pressures and environmental things. And, can you pick out this is an acute care setting and that this client is pale, diaphoretic, and, has issues with breath sounds, diminished breath sounds. So wanting you to be able to pick out that information. Okay. And they might have something like a vital signs tab and look and say, can you pick out these abnormal vitals that you should be worried about? So that's all the types of things that you're going to do for that question 1, okay, of the case. Judy, did you have a question?
Yeah, I think this is a good time to ask, in terms of lab values and conversions, say from Fahrenheit to Celsius, are they going to be providing you with normals or not?
Yes. So now they provide normals, and this is a perfect place to ask this question as I show this. So they will all have this reference range now. So in the new NCLEX that came out in 2023 of April, the next generation, they're providing that reference range. It's going to be in Canadian and US values. So you're going to see both metrics on the exam with your result. So it's all there. You don't have to memorize it. NCLEX does a really good job though. You still need to understand hypo and hyper values. So if someone's hyponatremic versus hypernatremic, what does that patient look like? Really important to understand those concepts because you might have the value, but you still need to know the significance of what patients look like and the symptoms they might be experiencing. But really nice that all the values are there with, and I'll just address this now with, medications, they have a generic medication. So remember this exam is the same whether you're in the US or Canada. And so the medications are all generic. So it's all generic. As far as Celsius and Fahrenheit, both will be on the exam. Any kind of value they'll share both the US and the Canadian conversion. So they're both going to be on that exam. Great question, Judy. Thank you for pointing that out. Okay, the second question of the case study is always analyzing cues. So now you've picked out those important things. It wants you to analyze this. So what conditions are consistent with the cues that you've picked out? Is there anything that supports that or contraindicates that? Or, what kind of things are you concerned with and what cues kind of go together? So looking at all the things and organizing and linking those cues together to figure out that client's presentation. That's what they want you to do in question 2. And so you'll see things like drag the findings over. And it's really a lot of putting those things together and looking at your individual knowledge of the medical conditions. So can you figure out, what does someone with a PE looks like versus someone with a hemothorax? What differentiates the two? What kinds of symptoms would you see with one versus the other? Those kinds of things. So that's what they're looking for in question number 2. In question number 3 on every case, you're going to prioritize the hypothesis. So you're going to evaluate and rank all the things that you think are going on according to priority. So what would most likely explain what's happening versus least likely explain what's happening? What's possible? What's most serious? What do you need to address first? So looking at ranking them as, what is happening with now you kind of have figured out what's happening, but what is your most priority of this situation of what's happening with this case. Okay. So things like questions look like this. So the client is at highest risk for developing, and then it might have a drop down followed by this or because of this. And so really looking at what kinds of cues are there that are leading you to prioritize that health challenge that you've determined. Okay, that's always number 3 in the case. Number 4 now is to generate solutions. So you want to identify outcomes using hypothesis and all sorts of interventions. What kinds of things should I be doing for this client? What things should be avoided? You really want to focus on the goals and figuring out what might be some of the things we need to do for someone in this case. So in this case, this is a nice little chart they have where, what are some potential interventions that you might do? Are they anticipated, not essential, or contraindicated? And you would have to click those off as you went through that case. So really kind of putting all that together and think, what do you think, would happen in a case with this? What are some solutions, maybe some diagnostics, some blood work, all those things that might be done for this client? Number 5 is always taking action. So now that you figured out, these are all the things we might do, then you want to look at what would be the highest priority. So which intervention or combination of interventions would be most appropriate? How do I do that? What do I need to do to take this action? Those kinds of things are looking at figuring out how are we going to take care of this client now? Okay. So questions again are going to look at, in this case, you're preparing the client for surgery. What action would you do first? And it's a select all that apply. So looking at from your nursing notes, all of these tabs, sorry, my mouse, all of these tabs and all of this case information is going to be there, and you can look at it as much as you like. So you could click on the nurse's notes, you could click on the vital signs, you could click on the lab values. You can look at all these things as much as you need to during those questions as well. So you're going to look through stuff, figure out, okay, now what is, my action that I need to take in this case. Okay. And then the last, so number 6 out of all the cases all the time is going to be evaluate your outcomes. So what you did, was it effective? Are they improving, declining? Are they unchanged? What if interventions were the most effective? What happened and, with this client, and did it work? Okay. So in this case, this is a highlight question, but like highlighting what would, indicate that they're not progressing as expected. So looking at, did what we did it work? Is this client better or worse? Or are they unchanged? So that's always number 6. Okay. So sometimes knowing what that case flows like can really help students figure out how to answer those questions and what they're looking for in every single step along the way. Any questions about that before I go through the question types? Am I still okay, Judy?
You absolutely are. I'm mesmerized by your presentation. It's
Sorry,
really
I do have one question.
Sure, you bet.
From an individual watching. When are the case studies put into the test? Are they together at the start, end, or split up between?
They're all over the place. Yeah, they're all over the exam, throughout the exam. So everybody will have 3 and they can be spread out whenever in the exam. And remember, those ones are stagnant. They're the only questions that are not computer adaptive. So remember, all the other questions are going to change depending on how you answer, but the case, you're going to get those 6 questions with that case. And no matter how you answer, it won't change. Like it won't get a different question because you answered the previous question a certain way. And so one piece of advice for the cases I can give students as well is I've had students when we're practicing them in my program, we have live online sessions and we practice. Sometimes students will start going down the wrong path at the beginning and they get the first couple of questions and they're thinking it's something else and that's what their train of thought was. And then they realize, oh, it's not that, it's this. You can change your mind. You still have 3 questions left or 2 questions left. That's okay. You just regroup and finish the questions now with, whatever new knowledge piece you have or whatever had happened that made you change your mind. Okay. So you can't go back, but you can keep going forward with kind of your new way of thinking about that case. Okay.
I was just curious, this clinical judgment approach from NSPN,
Yeah.
ESPN, is that new to the NGen?
Yes. Yeah, it's with NGN, the whole model. That's all brand new information and just started. So they're just still gathering all the data on that and testing that clinical judgment. But I think it's been pretty positive so far. Students tend to really like the case studies. They make sense. But again, you need a strong content knowledge as well to go through those. So, but we're hearing a lot of positives from it. That's for sure.
Awesome, thank you.
Okay, I want to show you the question types quickly, just so you're aware. And again, I always encourage students to get a resource that has all the question types. So you want to practice these. Hopefully it's not the first time you're doing a question like this, when you're in the NCLEX itself. So most of you are familiar with the multiple choice, just kind of look like something like this. Again, this is either you get the question a mark for getting it correct, or no marks for getting it incorrect. So there's still lots of multiple choice on the NGN exams. This is called a matrix multiple choice. So it is a multiple choice question. So in this case, this would be related to the case. So a case like we just saw perhaps, and it's asking you to figure out if these assessment findings are improved, no change, or declined. And so there is a correct response for each row, and either you get that correct or incorrect. So there's no partial marks for this. In this case, a respiratory rate of 36 has declined. You would need to get that correct in order to get that mark. So you would get a mark for each row, depending on the scoring. So again, just another kind of way to ask a question. This is called a multiple response select N. And so we're seeing these a lot in the case studies as well. And the N just means select a number. So in this case, it's saying select the 4 findings that require immediate follow-up. So instead of having a select all that apply, it's actually telling you how many you need to choose. So you do need to choose 4 before you would be able to hit submit and move to the next question. And so again, there's 4 answers. So this is a incorrect or correct response. You're not going to get those partial marks like you do for the select all that apply. So there's nothing to over or under respond. It's telling you need, in this case, 4, it might be 3, could be 5, depending on how the question is posed. This is called a drop-down close. And so in this case, this is again related to a case study, and you would have a drop down of a list. So the nurse should insert, and then it would, you'd have the choices, and you would just go through and drop down and fill in the blanks to those. And so again, 1 correct answer for each of them, 1 mark for each of them that you would get correct. No marks for incorrect. Okay. Next is similar, it's just a drag and drop. So in this case, you have your word choices and you're just going to drag them from the word choices and put them in the boxes. And again, either correct or incorrect, possibly, 3 marks in this case, depending on how many you get correct. This is a drop-down table. Again, another version of this. So they're all very similar. Lots of students stress about, oh, there's 14 new types, but they're very simple. for the most part, and you're seeing these mostly in the cases. And so it can be, they're fairly simple. Again, you're just in this one, you're just selecting, and there's one correct answer for each row. Okay, this is a little bit more complicated. This is a bow tie question, and this can be a little bit complicated. So remember, we talked about those 6 steps of the clinical judgment model. This is the only question on the NCLEX that uses all 6 steps of the clinical judgment model. And so it's interesting because it's saying that it's actually going to, test your knowledge of all those 6 steps all in one question. And so we have some strategies in our program for answering all kinds of questions, but definitely this type as well. And it can look a little bit confusing. So it looks like a bow tie with your potential conditions in the middle. So whatever the client is most likely experiencing, the actions to take, and the parameters to monitor. So you got to make this whole thing work related to the case. So it's going to give you some information, a bit of a case, and then you're going to do this. So you may have a bow tie item on your exam. So make sure you practice some of those as well. And this select all the and apply, this is like probably the most dreaded question for students. Students do not like them. Give me a thumbs up if you don't like the select all that apply. I know that they can be difficult, but the good news is you are getting those partial marks. So, making sure you still don't, be too quick to, select them all or anything like that. In NCLEX, one response could be correct or they all could be. So they don't give you a lot of guidelines with that. But again, a mark for every correct answer, a negative for every answer that's incorrect. And then, you only get to 0. So you're never going to go into that negative. So you're going to see quite a few. The way the NCLEX works as well. So remember, we looked at that yardstick, and as the exam gets more difficult, you end up getting more select all that applies because you're generally a more difficult question. This is a highlight text. So this is where it's asking you to highlight certain things. In this case, what would require follow-up. Now there's boxes. So sometimes students say, oh, I'm nervous. Like I want the temperature, but I didn't want to click all this. The whole box will you'll either select the whole box to highlight or nothing. So you don't have to worry about a partial sentence or anything like that. So, it's clicking and highlighting the entire kind of chunk of data, whether you want to highlight or not. So there's also highlight tables that you may see as well. So this is having you highlight right in the table. Okay. This is called a matrix multiple response. So in this case, it is kind of like a select all that apply, but it's in this version, it's in a matrix. So again, looking at this, do you have decreased appetite in bowel obstruction, appendicitis, and ruptured spleen? And then you would be checking these off. And so depending on how you're approaching questions, look at the question and try to figure out whether it makes sense to do rows or columns. So depending on your case and how they're asking that question, you want to make sure you're doing it in a strategic fashion, that you're not going to miss anything. Okay. And this is similar as well, but this is just multiple response grouping, where they're grouping chunks of data. So again, approach it where in this case, you'd want to stay with all the neuro stuff first and kind of go through that, choosing that. And so it'll sometimes give you little bits of information as well. So in this case, it would say with this question, in each category, you must have at least one response selected in each. So if you're wondering why you can't hit submit or go forward, sometimes, check those instructions on that question and make sure that you're doing that correctly before you move on to the next question. This is a drop down rationale. So remember, we talked about the rationale scoring when, X equals Y. So again, in this case, you would have to get both of those things correct in order to get that mark. So this is something, that may be part of one of the case study questions where you have to get both those parts correct in order to get the mark. And similar, it could just be in a drop down table findings where you're dragging and dropping instead of the drop downs. So either way, same type of question, a rationale question when the 2 items are going together, or there could be 3 items in that case as well. Okay, I'll just briefly talk about my program and then I'm going to open it up for, do we have a couple minutes for questions after that, Judy?
Absolutely. We've still
Okay,
got a clear majority of the individuals here, so.
thank you. Thank you for staying on, everyone. Awesome. So we have two programs. You can look up all the information on NCLEX Education. I think Judy, thank you. You just put that in the chat box. I appreciate that. Lots of things, things that we're really proud of. We have a coach companion program where you actually get a coach to help guide you every step of the way with live drop-in sessions. You know, you're able to email your coach, ask questions. So sometimes students, you know, that you're the type of student that wants that guidance and that reassurance, and someone to really help you every step of the way. You know, that would be a really good option for you. Others, you might want to do it yourself, but you don't know where to start. You don't know how to make a study guide. You don't know, you know, I want to make sure you get the right questions. You want to make sure that you get the unlimited exams and, you know, all of the step-by-step algorithms and cheat sheets. And you might be better suited for a self-study program. So we do have two options on our website. I also have a free phone call on my website. So if you're not sure, you know, you're interested, but you're not sure what program would work for you best, you can definitely sign up for a free phone call. I'm happy to chat with you about anything NCLEX for 15 minutes so that you can determine what works best for you. Like Judy said in the intro, we have an extremely high success rate. We don't track our self-study, but our faculty facilitated for everyone that's completed the program, they've passed. So we're really proud of that. Our coaches will work with you until you get that RN behind your name, whatever that takes. So we're very proud of that, and I have the very best coaches that help me in our program. So the other thing is I have lots and lots of free resources on our site. So feel free to get on my, you know, NCLEX site. There's some free webinars, also social media. So we are on Instagram, we're on Facebook. I'm trying TikTok. It's not going great, but we're trying. But we actually on our Instagram, we do a tip of the day or tip of the week. We do questions on there all the time. So even if you're like a little ways out of NCLEX, follow, because there's lots of really good information on there that will help you. So you know, follow that on social media if you like, and hopefully get some of the good free stuff out of it as well. Okay, so I didn't tell Judy this, I don't think, but for our program, these are our Canadian prices. So the self-study is $447. You have 6 months access in our program. So unlimited access for 6 months in either program. So if you want to start early, which we always encourage you in that last semester of school to start, that's the best time to start if you can, but you don't have to rush because you have 6 months. And then that coach companion is $847. It includes everything you need, question guides. You don't need any other resource. So today, this discount will be good for a while. So the NCLEX NTF will give you $50 off either one of those programs if you're interested. Okay, let's open it up for questions. There's the at NCLEX Education, the Facebook and Instagram as well there. So any questions?
Well, while people have been really open with their questions to
Yeah,
those.
that's good.
Thanks everybody for being so comfortable. That's a testimony to Shelley's presentation. And Shelley, I just, all I can say is thank you, thank you, thank you for all
Oh,
the
you're very welcome.
give these students, and perhaps there are new grads watching that are about to take their NCLEX, and yeah, I really appreciate that $50 off. That's very generous, and thank you so much for that. Do we know how long how long will the coupon code be valid for?
I can just leave it indefinitely. So, or if for some reason it does not work, just feel free to email me. But I think I'll just leave it open indefinitely in case people are watching the video later on as well. Or maybe you're in your third year or whatever that might be. So, yeah.
Great. Well, thank you for that. That's very nice. Are there specific textbooks that you recommend these students or grads take a look at?
Yeah, we recommend keeping some textbooks for our program as well, because you have to be very careful when you're picking resources, because some of the resources out there are not textbook based. And this exam is definitely based on textbooks. And so I usually tell students when you're graduating and you want to get rid of those books, we all kind of felt that way. Do not get rid of your books. The books that you should be keeping is your foundational textbook, your med surg book, your assessment book, and some kind of drug guide. Those are ones that you need to make sure you keep until you for sure have that RN behind your name. So you'll use them, you should be using them in your studies. The other books, I mean, some of those ones cover some of the stuff. Depending if you have some gaps and weaknesses, there could be other books you might want to keep, but those are definitely crucial in studying for NCLEX for sure. So, and whatever type you used in school is fine. So whether you used, Perry and Potter or what, it doesn't matter. It doesn't really matter the authors, just that you sort of have those books.
And how about in terms of preparing for the NCLEX? Do you have a textbook, or do you have a textbook that you recommend that students could look at to get questions or anything like that, tips?
Yeah, so we have, our program is all on an live on a platform. So it's on a learning management system. So we have a platform that you access with everything you need. We do want you to have your textbooks as well that you would use in school. We do have some online resources if you don't have your textbooks, but we have all of our cheat sheets, our study guides. So for one thing we do right off the bat for our foundational section is we give you a list of all the diseases that are on the NCLEX. And so we list them according to system. So for example, respiratory, here's all the diseases that are tested on NCLEX. This is what we need you to know about them. So we also have a video for every single disease process, just for students that maybe like to watch a video a little bit more than maybe reading. We do still encourage you to use your textbooks, but we really pride ourselves on sort of active study strategies as well. So I don't know, many of you might feel the same, but you can read something over and over and over and it just doesn't stick. And so we really get you to do active study strategies. And then we follow that up with questions. So for example, let's say you learn about heart failure. We're going to let you figure out, you're going to piece it all together kind of in an active way that we teach you. And then you're going to go do questions. So you'll do all cardio, then do all cardio questions till you're way above at that level 8 that we talked about. Then you move on. So it really helps flesh out your own weaknesses and your gaps as you go along the way. So yeah, so every student does different amounts of questions in our program because you might need more in one area. Maybe you need more farm. We have an entire module on farm, but maybe you need more questions in certain areas than others. And we don't want to waste your time, but we also want to make sure we provide what you need for each section. So yeah, it's a little bit.
I was just thinking that if I were asking for a graduation gift these days, it might be a coached study session with
Yeah.
you. So I think it's
Thanks,
wonderful that
Judy.
you have those options, and I hope that the students and grads that attended today will take advantage of that, Shelley.
Yeah, thank you.
Have any other questions? So I think we'll let you go. We've taken so much of your time already, and there will be a recording available of this session posted on our NTF Live website for anyone who's interested in taking a look again. It was incredibly helpful, and I'm so grateful to you for the presentation, Shelley.
Well, thank you for having me. And like I said, we are so passionate about helping students. So if you ever have a question at all, please just email me. I'm happy to answer it. Even if it's related to anything NCLEX and I can help, we're more than happy to help. Give us a follow on social media and good luck in your preparation. I always tell students, you've come this far, you can absolutely do this. So I hope I didn't scare anyone. We are here to help, and hopefully we will work with some of you in the future. So thank you so much. Thanks for having me, Judy.
Thank you, Shelley. Thank you so much. And all the best to everyone. Please understand that once you graduate, you have the capacity to pass this exam without issue. The key is in preparation, and Lord knows I've had to prepare for a few of these exams myself over the time. I remember writing the critical care registered nursing exam was 5 hours, that sort of thing. And it was nerve-wracking, but it was kind of fun and exciting at the same time.
Yeah.
because, you know, we want to be tested about our knowledge for
Yes.
whatever that's worth. So I
Yeah.
know we'll all do well. But if you can, I think a session self-study or coached would be a really great bet for all of you. So take care, everyone, and don't forget to reach out to NTF if you have any concerns or questions about your transition. Bye, everyone.